Type 2 diabetes does not have to be a lifelong sentence. For many people, it is a condition that can be dramatically improved and even reversed with the right approach. So if you're ready to improve your health outcomes, prevent or even reverse type 2 diabetes, this video is for you. So we're going to cover the root cause of type 2 diabetes and why it's really discussed, the three-phase strategy that I use in my clinic to help people prevent and reverse their diabetes, and the one thing I'd be telling you to do right now as a practicing doctor. When I first trained as a doctor, the story about type 2 diabetes was clear and a bit bleak. We were taught it was a lifelong progressive condition. You start with one tablet, then add another, and eventually end up on insulin. The best you could hope for was to manage the decline and delay complications for as long as possible. But this is not true today. You can reduce your risk of developing type 2 diabetes, and you can reverse it in many cases. After years of working inside and outside the NHS, I have to see something different. I see people not just managing their diabetes, but actually putting it into remission. Blood sugars returning to normal, people coming off medications, and most importantly, lives being changed. And it wasn't just luck or genetics. There's a pattern, a clear reason why some people can make progress, but others don't. Now, oddly, the idea that type 2 diabetes can be reversed is still surprisingly not mainstream knowledge. Many people, and even many doctors, still see diabetes as something you live with, not something you can change. The guidelines do mention lifestyle change as the first-line treatment, but in reality, most appointments are so short, support is limited, and the advice is often vague. So try to lose weight, eat a bit better, move more, without any real detail on how to do it or the support to make it happen. And for decades, the focus has been on managing symptoms and developing new medications. There's been an enormous drive, backed by research, funding, and pharmaceutical development, to find the next best drug or treatment. And while medication absolutely has its place, it often means that the root cause gets overlooked. And remember, the root cause of type 2 diabetes is insulin resistance, which I'm going to explain to you in a minute. But what's more is that the idea of remission is still met with caution. Doctors are trained to be careful with promises, and because remission isn't guaranteed for everyone, it's often not discussed at all. And yet, when you look at the latest science and the real world results from people who focus on this root cause, the picture is so much more hopeful than most people ever realise. So at the heart of type 2 diabetes is a story of one organ being asked to do too much for too long, which is your pancreas. For years, it's been working overtime, producing insulin every time you eat foods that raise the blood glucose, especially those carbohydrates. Over time, just like any part of the body under constant strain, it starts to struggle. It becomes less effective, and eventually it can't keep up at all. If you think about it, when any organ or system is burned out, the best way to help it recover is to take away the workload. For type 2 diabetes, that means reducing the foods that make your pancreas work the hardest. And this is, of course, sugary snacks, but it is also carbohydrates such as bread, pasta, rice, and potatoes. Now, I'm not saying that to punish you or to tell you to give up everything you enjoy eating, but it is the way to give your body and your pancreas a real chance to heal. When you lower the demand on your pancreas, you're not just managing the blood glucose, you're addressing the root cause. You're giving your body the opportunity to restore balance, and it reduces the need for medication, and you can start moving towards remission. And what's interesting about remission is that, despite all the focus on new medications, complicated treatments, the best results consistently come from lifestyle changes, not the tablets. If you look at the major studies on diabetes remission, like the DIRECT study, medication alone rarely leads to normalising that HbA1c, and certainly not over the long term. It's the people who make changes to what they eat, how they move, and how they live are the ones that see the biggest transformations. These results aren't about adding medication. It's removing the strain on the pancreas, letting the body do what it does best, which is healing itself. And what's even more powerful is that these lifestyle-driven changes don't just improve blood glucose, they often lead to weight loss, lower blood pressure, improved cholesterol, and obviously better energy and mood as a result. The benefits just ripple out into every area of your life. And it's a reminder that our bodies are designed to heal when we give it the right conditions. So tablets help manage the symptoms, but it's lifestyle, the daily choices you make, that truly gets to the root of the problem and opens the door to remission. So if you're looking for hope, know this: the most effective, proven way to achieve remission isn't found in a prescription pad. It's in the food you eat, the habits you build, and the support you give yourself along the way. You have way more power than you realize. So let's dive in. When people ask me, how do I actually reverse type 2 diabetes? I see it like this. It's not about a single magic bullet, because it's a journey. And I think there are 3 distinct phases. Each phase builds on the last, and together they give your body the best chance to heal and thrive for the long term. Phase 1, what you eat. So giving your pancreas a break. The first and most powerful step is to change what's on your plate. This is where the real magic happens, and it's the foundation for everything that follows. Specifically focusing on lowering carbohydrates and prioritizing real food, protein, and yes, fat, you immediately reduce the strain on your pancreas. And this isn't just a theory, it's what I've seen work time and time again, both in clinical studies and in my own practice. Why low carb? Well, quite simply, carbohydrates, especially the more processed they are, bread, pasta, and then rice, potatoes, and sugary snacks, are the main drivers of blood glucose. They force your pancreas to work really hard. Every time you eat them, you have to release a surge of insulin to bring the blood glucose back down. And over years, this relentless demand is what wears out our pancreas and leads to insulin resistance. If you reduce those, you're not just cutting calories or following a fad, you're addressing the root cause. This is why, out of all of the diets and approaches out there, low carb consistently delivers the fastest, most dramatic improvements in blood glucose, weight, and energy. It's not about deprivation or giving up everything you love. It's about making smart swaps, choosing foods that keep you full, satisfied, and steady levels, rather than the roller coaster of cravings and crashes. Now, this is unlike calorie counting, which often leaves people hungry, frustrated, and destined to regain the weight. A low-carb approach works with your biology. It calms the hunger hormone, stabilizes your mood, and helps you feel in control again. And the best part is you can see results, sometimes within days or weeks of just starting. So that is where I would start. The second phase is supporting your whole body, so making yourself more sensitive to insulin. Once you've started to give your pancreas a break with the right food, the next step is to support your whole body so it can use insulin more effectively. This isn't about perfection or pushing yourself to extremes. It's about building small, sustainable habits that add up to big results over time. Now, movement is powerful medicine. You don't need to join a gym or run marathons for this. Just gentle activities, walking, puttering around the house, gardening, dancing if you want, stretching. They build your muscles, and they're like cupboards for sugar. Any of these help your muscle use up more of the glucose from your blood, making you more sensitive to insulin. The key, of course, is to find movement that you enjoy and you can do it regularly, not necessarily perfectly. Now, sleep is your secret weapon as well. When you're sleep deprived, your body becomes more resistant to insulin. Cravings for sugary foods often skyrocket. Prioritizing good sleep, so aiming for a consistent bedtime, creating a calming evening routine, making your bedroom a restful place, can make a huge difference for your blood glucose control. Which brings us on to stress. This matters more than you think as well. Chronic stress floods your body with hormones that raise your blood glucose and make it harder to lose weight. Now, you don't necessarily need to meditate for hours. Simple practices like just slowing down, deep breathing, spending time in nature, connecting with a loved one, can actually help your body relax. And the third phase is mindset and making changes that last a lifetime. This is the phase that most people overlook, but it's the one that truly makes changes stick. Even with the best food plan and healthy routine, nothing lasts if your mindset is not on board. I think that lasting change really starts in your mind. It is about working on your beliefs, letting go of the idea that you're not the sort of person that can be healthy, or that setbacks mean that you're a failure. The truth is that everybody slips up. What matters most is how you respond and how you get back up. Habits are actually built. You're not born with them. Real progress comes from turning those small actions into regular habits. And that could mean things like planning your meals each week, a habit of taking a short walk after dinner, or just simply pausing for an hour each week just to sit and see how you feel. Because over time, these small changes will become automatic and part of who you are, not just what you want to do. I think it's really important that we pay attention to the way we speak to ourselves as well. We are our own harshest critic. Try being aware of any criticism and switch it to encouragement. Remind yourself of how far you've come. Celebrate every small progress. It doesn't matter how small it is, because it is about progress. We're not aiming for perfection. You don't need to get it right every day. What matters is bouncing back after a setback, learning from it, building new relationship with your health. Please remember that the journey to remission isn't just focus on what you eat or how you move. It's about believing that change is possible and giving yourself permission to learn, to get it wrong, but to keep going. Now, I know when you combine all of these things, you can get 1 in 3 people to reverse their diabetes within 6 months. And that's what I do in my clinic. I've seen lots of lives change, not because they were perfect, but because they understood the real cause, made practical changes, and kept going even when it wasn't easy. So if you're in that place, you're feeling stuck or skeptical, please know that it's never too late to start making progress. The most important thing is to take that first step, however small it might seem. And if I could give you just one piece of advice as a doctor, it would be this. Start with your breakfast. It truly is the single most important meal of the day because it sets your blood glucose, your energy, your cravings for everything that follows. So if you do one thing differently this week, swap out the toast, cereal and porridge for a high protein breakfast. My top recommendation is eggs because they're so versatile, scrambled, poached, boiled, however you want it. They're filling, they're packed with protein, and they can keep you satisfied for hours. And of course, if eggs aren't your thing, why don't you try Greek yogurt, the plain, full-fat, unsweetened version? Handful of berries, some seeds, nuts. Or if you prefer savoury, what about slices of ham, smoked salmon with tomatoes, spinach? Give it a go. Again, you don't have to be perfect, but just do one change. Notice how much steadier your energy and mood feel and how much easier it is to make good choices for the rest of the day. Progress starts with a single step, and breakfast is the best place to begin. And if you'd like more practical tips, recipes, support to make this journey easier, start with downloading my free 12-page blood sugar mastery guide because it's packed with simple swaps, meal ideas, and encouragement to help you take the next step with confidence. The link is below, and thank you for listening.